increasing in the northwest. 14 new cases of the disease have been found in the region in the last week, most of them in Greater Manchester. Well, now health officials are urging parents to get their children vaccinated, as Mairead Smith reports.
A disease that was once eradicated is now worrying health leaders in the northwest. 14 new cases have been recorded over the last week alone, with most of those in Greater Manchester.
My friend, a little girl's at school at the moment and they had 3 cases in their school, so she was really worried.
Have you vaccinated your youngsters?
Yes, definitely. They're up to date with the vaccinations and they'll be getting any vaccinations that anybody recommends. If it's going to better your children, vaccinate them.
The MMR vaccine is given out at GP surgeries as part of routine NHS vaccines. The first dose is given to a child after they turn 1 and the second dose before they start school full-time. The issue is, though, that over the last decade, the uptake has fallen, with around 1 out of 10 children starting school without protection. Misinformation in the late 90s about the MMR vaccine being linked to autism led to a decline in vaccine uptake. Researcher Andrew Wakefield was struck off by the General Medical Council in 2010.
The problem with measles is it's so very contagious, and we did manage to eradicate it previously, and now we're worried that it's back in circulation. And one person can infect up to 15 people just by very limited contact. So that's a really highly infectious disease.
What impact can it have if a child or an adult contracts measles?
It can be really quite devastating. I mean, 1 in 10 children who get measles will end up in hospital with complications on average, which is huge for a childhood illness.
Dr Wall says they're reviewing when and where the vaccine is issued.
And what we are doing now is asking practices to work together in collaboration and deliver evening and weekend clinics, because we want to be able to give parents that other option of coming outside of work, core work hours, to vaccinate their children.
New parents Pippa and Ben say they'll take up the vaccine when the time comes.
Obviously you wouldn't want your baby to catch it. We're kind of pro-vaccination really, aren't we?
Yeah.
Anything that can stop your little one getting ill, we're all for.
Dr Wall wants people to know the vaccine is tried and tested with alternatives for those who need it.
There are MMR vaccines available that don't have any pork products in, so I think it's really important not to be put off by that. It's a very successful vaccine that's been given to hundreds and thousands, millions of children across the world, and we know that it works and we know that it's safe.
Anyone with symptoms is asked to call NHS 111 or contact their GP. Mairead Smith, BBC Northwest Tonight, Bolton.
Police have released footage of the man they believe is responsible